So you've kind of touched on it a little bit there with improving supply. Some women don't get a great supply, and sometimes they have to have medication to improve their supply. You said earlier on that the supply might be affected if they weren't put straight on during the golden hour, demand supply kind of issues. What are other reasons why their supply might not be great?
Lots and lots of reasons, but there are two different types. So is it a perceived low milk supply or is it an actual low milk supply? Because a lot of women will come to us saying, I've got a low milk supply, I need to do this. But actually, when you look at that, they've got an amazing supply. So we need to sort of just, understand what the situation is first. But for some women, it can be related to their anatomy. They might have insufficient glandular tissue. They may have had previous breast surgeries that can affect their milk supply, such as augmentation and breast reductions and things like that. It might be the fact that they've had a significant postpartum hemorrhage, which can have an implication on your breast milk supply, and certain physical conditions as well that can affect their milk supply, especially if women are following a routine as opposed to following their baby. That can also reduce their breast milk supply. So it's really important to feed your baby on demand and observing their feeding cues. Minimum feeding for a newborn is around 8 to 12 feeds in a 24-hour period, day and night. Your breasts don't switch off at night, unfortunately, and that's actually a really important time to feed your baby for your breast milk supply. Your prolactin level is highest at night, which is a hormone responsible for producing the milk. So hence why it is important to stimulate breast day and night.
It's a tough gig, ladies, but
it really
you've got to do it.
Unfortunately, I wish I could say, sleep all night, you'll be fine. There are other reasons, such as one, it's called the top-up trap.
Okay.
You might have heard of it.
No.
So some women start topping up their babies because they think that their baby has, or you have a low milk supply and your baby's
not top up with formula.
With formula. And that in itself is just a vicious cycle, and it will just lower and lower your supply over and over again. There are medications that you can take to help increase milk supply. I'm sure you're aware of them, being a pharmacist. But you definitely need to seek IBC or CETA support before that decision is made to see if it's warranted. You can't just go popping a pill because you think it might be helpful. So definitely seek support early if you feel like you may have some supply issues.
Yeah, so those apps that try to put baby on a schedule, on a feeding schedule, sleep schedule, they can...
they're really dangerous.
Yeah, it sounds like it.
They are. And there's so many books out there, popular books circulating that suggest women feed exactly a number of minutes. So 13 minutes on the right, 12 minutes on the left. It actually doesn't make any sense. Every woman's breast milk storage capacity is different. One woman could store 150 mils per breast, another 60 mils. So that baby wouldn't need to be fed as frequently, and that baby wouldn't, need more frequent feeds. So if there's any of those books that you're coming across or any of that information, you need to just push that to the side and really follow your baby's leads.
So can you feed a baby too much on the boob?
No.
Just pop them on there.
No. Put them on.
Yeah. What was that saying that you said before?
Whip it out. That's not my saying, but I do like to say it. The Milk Meg, she's another lactation consultant. She uses that phrase often, and I love it.
It's good. If you're not sure, if your baby's upset or crying, always try and offer the boob. It's often can just settle things.
Yeah.